Are you a weekend athlete? Well, you better listen up because potential injuries might threaten to take you out of the game this spring. Tips that will keep you off the sidelines in the warm months as they approach. We have Dr. Nick Shamie talking about how we can prevent those injuries. We think we're fit and able to do it. We've hibernated all winter and we race out onto the baseball field and we get hurt.
Hi, Tanya. How are you?
I am well.
I think your point is well taken. We all try to get active now that the weather is getting better, and that's when we can injure ourselves. So my advice to you is to start gradual. Start with 5 minutes a day and work yourself up to 30 minutes a day, 5 days a week. And that way your bone and joints are going to get used to this new level of activity, and you can avoid hurting yourself.
Doctor, there are 3 pillars of health. Would you explain those to us?
Absolutely. The 3 pillars of health that I'd like to talk to you about, composed of healthy diet, which includes vegetables and those dark green vegetables, the leafy vegetables that have a lot of vitamins and minerals. And because our diets are not always filled with all the things our body needs, we need to take some vitamins and supplements, other supplements, to give us the best composition of all the things we need. And once our body is ready to exercise, to make sure we use that food that we have taken in to do some good regular exercise. And again, I like to underscore regular.
Okay, so that's physical activity every day, because that is the key to getting us in shape for those big weekend family games.
Absolutely. And you know, we all get excited about the nice weather that we have and we get back in the swing of things, but my hope is that we can continue that level of activity throughout the year, because the goal here is to prevent disease. And if we have that 3 pillars of health in mind, we can perhaps avoid some of the things that can happen to us as far as injuries. And a nice way to figure out where you stand in these 3 pillars of health is to go to lifesupplemented.org, which is a website where you can take a test which takes about 5 minutes. It's a wellness scorecard, and then that gives you an idea of how well you're doing in those 3 pillars of health that we're talking about. And then you can take that to your doctor and have a discussion about how you can improve your health and maintain your health.
You know, Doctor, I suspect it's not only those football and baseball and basketball games that we engage in with the family and friends. Sometimes it can be, if even we start a walking routine, we might do that a little aggressive, too aggressive at first. We need to build up to that.
Absolutely. I think any exercise that you do that your body's not used to, you need to build up to that level that you want to get into. Just because you were able to do it last summer doesn't mean this summer you can go right to that same level. So you need to build it up.
You know, I'm guilty of that. I'm not active in the winter as much as in the summer, and then you walk out some summer day and it's beautiful and you think, well, I can take this hike, I can hike this mountain. Well, you're not in shape.
Yeah, absolutely. I think we're all guilty of that to a certain extent, especially as we have busy lives with kids. But you know, I think it's important to set good example for our kids and making sure that they understand the 3 pillars of health, so they can get into those good habits early on in life, which is going to help them prevent disease and problems in their bone and joints later on in life. In fact, if you look at my colleagues orthopedists, they recommend this good healthy lifestyle, and 9 out of 10 of them recommend taking vitamins and other supplements to their patients, and in fact 3/4 of them take it. So this is mainstream. We all want to be healthy, we all want to take the right type of food and supplements, and we all want to exercise regularly. It's just making the effort that's the tough part.
Well, Doctor, thank you so much for talking to us today. How's the weather we caught up to you in Los Angeles, didn't we?
Yes, you did.
How's the weather over there today?
The weather is, you know, nice. I have been in the studio this morning, so I don't know how it's out there, but I bet it's going to be as nice as Phoenix.
Okay.
We all are lucky, you know, and we really don't have no excuse not to get out and put a good exercise in. So let's get out there and have some fun.
Very well put, Doctor. Thank you so much for talking to us.
You're welcome. Have a good day.
You do the same.